What is lung cancer? Lung cancer is a type of cancer that starts in the lungs. Cancer starts when cells in the body begin to grow out of control. Can lung cancer be found early? Lung cancer screening is a process that's used to detect the presence of lung cancer in otherwise healthy people with a high risk of lung cancer. Lung cancer screening is recommended for older adults who are longtime smokers and who don't have any signs or symptoms of lung cancer. Screening is the use of tests or exams to find a disease in people who don't have symptoms. Research has shown that using LDCT scans to screen people at higher risk of lung cancer saved more lives. For higher risk people, getting yearly LDCT scans before symptoms start helps lower the risk of dying from lung cancer. In the United States, lung cancer is the most common cancer. It's also the leading cause of death from cancer. If lung cancer is found at an earlier stage, when it is small and before it has spread, it will be successfully treated. Who should have a screening test? A 2017 study in medical clinics of North America highlights lung cancer as the leading cause of cancer death in the United States. The CDC recommend lung cancer screening with LDCT for anyone who meets all of the following criteria: aged 50 to 80 years. A history of heavy smoking. Currently smokes or has quit within the past 15 years. Heavy smoking refers to a smoking history of 30 pack years. In a pack year, a person smokes at least an average of 1 pack of cigarettes per day for a year. For example, someone with 30 pack years could have smoked 1 pack of cigarettes per day for 30 years or 2 packs per day for 15 years. How often is screening necessary? Any individual who meets the 3 criteria should have the screening once a year, according to the Prevention Services Task Force. They advise people to stop yearly screenings if they turn 81 years old, have not smoked in at least 15 years, develop a condition that greatly limits their life expectancy, or prevents surgery for lung cancer. Benefits of screening. The American Cancer Society, ACS, state that the main benefit of screening is the lower likelihood of death from lung cancer. Many people will not experience symptoms of lung cancer until the disease advances. Some people may even mistake the early symptoms for those of another condition. Someone with a higher risk of lung cancer should have yearly screenings to catch the disease in its early stages, when it is easier to treat. However, screenings can still miss some types of lung cancer or only detect the condition at a later stage. Risks of screening. The National Cancer Institute, NCI, highlights some risks of regular lung cancer screening. Overdiagnosis. This term describes the diagnosis and treatment of cancer that may never have caused symptoms. False negatives. A false negative test is one that fails to detect a case of lung cancer and could, as a result, delay treatment. False positives. A false positive result indicates lung cancer where it is not present, causing unnecessary concern. Radiation. Regular, high doses of radiation from chest X-rays and CT scans can damage cells and increase the risk of cancer. Of course, doctors will weigh these possible risks against the benefits of screening in each case. Next steps if results are abnormal. Doctors will order more testing if the screening shows abnormal results. The ACS note that in many cases, additional testing will reveal that the abnormalities are not cancer. However, the tests are still necessary as a precaution. Doctors will use 1 or more imaging tests to examine the suspicious area more closely, including chest X-rays. These are usually the first tests that doctors order. CT scans. These scans show a detailed cross-section of the body and are more accurate than X-rays in detecting tumors. MRI scans. MRI scans provide a detailed picture of soft tissue in the body and are useful for checking the spread of cancer. PET scans. These scans involve the injection of low-level radioactive sugars that can highlight cancer cells. Bone scans. Bone scans also use a low-level radioactive material to highlight cancer cells that have spread to the bones. If imaging tests also suggest cancer, doctors will confirm the diagnosis by examining lung cells in a lab. They will remove the cells from lung fluids or tissues. Screening can reduce the likelihood of death from lung cancer, but it also includes some risks. Of course, doctors will weigh the risks and benefits of screening in each case. Signs and symptoms of lung cancer in men. In the early stages, lung cancers often do not cause symptoms in anyone. The symptoms tend to develop as the cancer spreads and progresses. However, early diagnosis and treatment can significantly improve a person's outlook. Non-small cell lung cancer, or NSCLC, is the most common type of lung cancer. Symptoms tend to be similar in males and females and can include a cough that lasts longer than a few weeks, coughing up blood, wheezing, chest pain, pain when breathing or coughing, shortness of breath, hoarseness, frequent lung infections, such as pneumonia or bronchitis, due to the cancerous cells obstructing the airways. Atelectasis, which is the collapse of the lungs after cancer has blocked the airways. If squamous cell carcinoma, a type of skin cancer, develops in the lungs, a person may also experience paraneoplastic syndrome. Paraneoplastic syndrome occurs when cancerous cells or cells from the immune system produce hormones or other substances that change surrounding tissue. It can cause symptoms, such as difficulty walking and maintaining balance, muscle cramps, involuntary movements, loss of muscle coordination, muscle weakness, trouble swallowing, slurred speech. Another type of lung cancer, called small cell lung cancer or SCLC, was once more common in males than females. However, the gap is closing because the rate of lung cancer in men has dropped over the past decade. SCLC typically develops near the central airways of the lungs, and it often spreads to the brain. Early symptoms may include headaches, vision changes, weakness on one side of the body, changes in behavior. If you have any of the above symptoms, see your doctor as soon as possible. Don't be subjective. There are two main classifications of lung cancer: non-small cell lung cancer, NSCLC. Non-small cell lung cancers are the most common type of lung cancer. These cancers account for about 90% of all lung cancers and are less aggressive than small cell lung cancers, meaning they spread to other tissues and organs more slowly. Non-small cell lung cancer is the most common type of lung cancer. More than 8 out of every 10 lung cancer cases are NSCLC. Within the non-small cell lung cancer category, there are 3 subtypes: adenocarcinomas, squamous cell carcinomas, aka epidermoid carcinomas, large cell carcinomas, adenocarcinoma. Adenocarcinoma is the most common histologic type of lung cancer, and begins in the cells in the glands located on the outer part of the lungs. It is most frequently found in women, non-smokers, and people under the age of 45. Squamous cell carcinoma. Squamous cell carcinomas make up 25 to 30% of all lung cancers, and are the most common lung cancers found in smokers. Squamous cell carcinomas are more common in men than in women. The majority of cases of squamous cell carcinoma start in the center of the lung. Often, and at an earlier stage than other tumors, squamous cell carcinomas cause symptoms such as coughing up blood. Large cell carcinomas. Large cell carcinomas tend to grow quickly and are usually undetected until they have metastasized. The rarest of the lung cancers, large cell carcinomas only appear in roughly 1 in every 10 cases. As more precise diagnostics have become available, many lung cancers previously diagnosed as large cell carcinomas are being reclassified as adenocarcinoma or squamous cell lung cancer. A lot of research is being done surrounding treatments for all forms of NSCLC, and there are many clinical trials in the pipeline for patients navigating NSCLC diagnosis. Stages of non-small cell lung cancer. Occult, hidden stage. In this stage, cancer cells appear in a sputum cytology exam or other test, though no tumor location can be found. Stage 0, carcinoma in situ. In this lung cancer stage, cancer cells are only found in the top layer of cells lining air passages and has not crept deeper into the lungs or spread beyond the air passages. Stage 1. A small lung cancer tumor, less than 3 centimeters across, is discovered, but has not spread to surrounding lung membranes, lymph nodes, or the main bronchial branches of the lungs. Stage 2. There are several ways that stage 2 lung cancer may be diagnosed. One is that the lung cancer has spread to lymph nodes near the lungs. Stage 2A. If the tumor is between 3 centimeters and 5 centimeters, the lung cancer is defined as stage 2A. Other factors can lead to this classification as well. Stage 2B. If the lung cancer tumor is between 5 centimeters and 7 centimeters, it is categorized as stage 2B. Other factors can lead to this classification as well. Stage 3. As in stage 2 lung cancer, stage 3 has several definitions. One is that the lung cancer is found in both the lung and lymph nodes in the middle of the chest. Stage 3 lung cancer is divided into 2 subsets. Stage 3A. This defines a lung cancer that has spread on the same side of the chest from where it started. Stage 3B. This defines a lung cancer in which the cancer has spread to either the opposite side of the chest or above the collarbone. Stage 4. This is the most advanced stage of lung cancer. The cancer can be any size, but two of these three things have happened. The cancer has spread to the opposite lung from where it began. Cancer cells have been discovered in the fluid surrounding the lung. Cancer cells have been discovered in the fluid surrounding the heart. Small cell lung cancer, SCLC. Small cell lung cancer, also called oat cell lung cancer, accounts for about 10% of all lung cancers. This form of cancer tends to spread quickly. Small cell lung cancer is a much less common form of lung cancer, affecting roughly 1 in every 10 people diagnosed with lung cancer. Small cell lung cancer is particularly aggressive. It often returns after initial rounds of chemotherapy. Small cell lung cancer stages. Limited stage. In this form, small cell lung cancer is limited to one side of the chest, typically in the lungs and lymph nodes. About 1 in 3 people with small cell lung cancer have limited stage cancer upon the first diagnosis. Extensive stage. This refers to small cell lung cancer that has spread throughout one lung, spread into both lungs, to lymph nodes on the other side of the chest or to other body parts. About 2 in 3 people with small cell lung cancer have extensive stage cancer upon first diagnosis. Treatment options for lung cancer include chemotherapy, a type of medication that kills or shrinks tumors. Radiation therapy, which uses high-energy X-rays to kill cancer cells. Targeted therapy, involving a selection of drugs that stop cancer from spreading. Surgery, which is sometimes an option to remove a tumor. Summary. This disease is difficult to detect in its early stages, and treatments for late-stage lung cancer provide a poor prognosis. Survival rates vary depending on the cancer type. According to the American Cancer Society, over 5 years the average survival rate is 24% across all stages of non-small cell lung cancer. The same average for small cell lung cancer is 6%. The 5-year survival rate for both types is higher if diagnosed and treated while the cancers are in the localized or regional SEER stages. However, distant stage lung cancer stages are worse. If lung cancer is detected at an early stage, it is completely cured. Therefore, screening for cancer is essential and it can even save your life.